On the evening of Saturday, July 11th, EMS was called for an unresponsive 71-year-old male. The patient was Senator Lindsey Graham. He was found to be in cardiac arrest. The statement released by his office on Sunday cited preliminary findings from the District of Columbia's Office of the Chief Medical Examiner, identifying the cause of death as an aortic dissection. So what is an aortic dissection? In simple terms, it's an uncommon and potentially catastrophic disease process with a high morbidity and a high mortality involving a tear in the wall of your aorta, the big vessel coming off the heart to supply blood to the rest of your body. In medical terms, it's a tear in the intimal lining of the aorta, allowing blood through the tear into the aortic media, creating a false lumen. Now, one of the high-risk conditions associated with the development of an aortic dissection includes systemic hypertension. This is considered the most significant predisposing factor. Now, for Senator Graham, we learned that per the chief medical examiner, the cause of death was aortic dissection. He likely had systemic hypertension for a while, developed arteriosclerotic cardiovascular disease, or continued to have uncontrolled hypertension or uncontrolled high blood pressure, and eventually that pressure was so high it tore the lining of his aorta, leading to an aortic dissection. According to the International Registry of Acute Aortic Dissection IRAD review, as originally published in the Journal of the American Medical Association, the classic description of pain has often been described as an abrupt onset of this ripping or tearing sensation. However, this is only seen in about 50% of patients. The most common description is rather a knife or a sharp stabbing pain, and that's about 68% of the time. Patient symptoms are purely based on the extent of the dissection itself, the location, and the structures involved. Prior to the senator's arrest, the tear had happened. Blood started moving down the false lumen. The once high blood pressure he did have that started this entire thing resulted now in hypotension, disrupted or prolapsed aortic valve, severe aortic regurgitation, and extension into the pericardial space, leading to cardiac tamponade, and that is just what the dissection is doing to the heart itself. While this is going on, realize that tear can continue up towards the carotid artery and down the aorta as well. And so some of those clinical manifestations can be focal neurological deficits, hoarseness of the voice because that left recurrent laryngeal nerve becomes compressed. The patient can become paraplegic, secondary to ischemia of the spinal cord. Horner syndrome results from compression of the superior cervical sympathetic ganglion. And then, of course, multi-system organ failure. If they survive to the ER, they undergo CT angiography that demonstrates the dissection flap. In the case of Senator Graham, he likely had a Stanford type A dissection that led to his cardiac arrest. With the mortality increasing every single hour until definitive treatment, early recognition and prompt operative intervention are crucial for patient survival.